From WHO headquarters in Geneva, we have the privilege to welcoming three health ministers from Indonesia. I will let Dr. Tedros introduce their excellencies.
This marked one of the greatest public health achievements of all time.
Dr. Tedros, Director General of the World Health Organization, my fellow colleagues, Minister of Health from Thailand and South Africa, under the leadership of President Joko Widodo and the coordination of the COVID-19 Task Force Chief,
I now give the floor to the distinguished representative of Indonesia.
Keprihatinan kita menjadi semakin besar di saat pandemi COVID-19 ini. Di saat seharusnya kita semua bersatu padu, bekerja sama melawan pandemi, yang justru kita lihat adalah masih terjadinya perpecahan dan rivalitas yang semakin menajam. Kita juga paham virus ini tidak mengenal batas negara. No one is safe until everyone is.
You from WHO headquarters in Geneva and welcoming you to our global COVID-19 press conference today, Friday, 6 November. The health ministers will share their country's experiences on preparedness and response to COVID-19. I will let Dr. Tedros introduce their excellencies. The Director General, Dr. Tedros, will be joining us remotely.
Good morning, good afternoon, and good evening. In the summer, Africa was certified as wild polio-free. This marked one of the greatest public health achievements of all time. Driven by millions of health workers reaching every child repeatedly with an effective vaccine and a unique partnership between WHO, UNICEF, Rotary, CDC, the Bill and Melinda Gates Foundation, and Gavi, global polio eradication remains achievable. I would now like to turn to the Minister of Health of Indonesia, Dr. Terawan Agus Putranato. Minister Putranato, the floor is yours.
Dr. Tedros, Director General of the World Health Organization, my fellow colleagues, Minister of Health from Thailand and South Africa, ladies and gentlemen, good morning, afternoon, and evening. It is a pleasure to be invited and participate in today's event. The Ministry of Health of the Republic of Indonesia, supported by WHO Indonesia Country Office, has conducted a national interaction review for COVID-19 response on 11 till 14 August 2020. The IER is an immediate follow-up of the fourth IHR COVID-19 Emergency Committee meeting recommendation that was held in July 2020. Surely it is not an easy task to bring representative of 138 multi-sectoral stakeholders to conduct a review of the existing COVID-19 response activities in Indonesia. However, under the leadership of President Joko Widodo and the coordination of the COVID-19 Task Force Chief, General Luhut Binsar Panjaitan, representative from the technical unit within the Ministry of Health, other related ministries and government agencies, the national and regional COVID-19 task force, military and police forces, provincial and district government, hospital and primary health service facilities, laboratories, universities, professional associations, state-owned enterprises, and international organizations have been committed and been actively involved and contribute to the whole process of the IER. The involvement of the multi-sectoral stakeholder on the review is imperative in gaining a multi-perspective view of the COVID-19 response in Indonesia. This is particularly important because the IER in Indonesia covers the 9 key pillars of the COVID-19 response, which consists of the pillar of 1, command and coordination. 2, risk communication and community empowerment. 3, surveillance, rapid response team, and case investigation. 4, point of entry, international travel and transport. 5, laboratory. 6, infection control. 7, case management. 8, operational and logistic support. And 9, maintaining essential health services and systems. Indeed, active participation of such multi-stakeholder is a key for a success IER. Equally important, the multi-sectoral involvement in the IER has also increased the acceptability of the IER recommendation by all stakeholders. As a result, the IER recommendation have been used in the revised COVID-19 health sector operational plan at the national and subnational level, as well as in updating the COVID-19 partner platform. IER recommendation contribute to the improvement of the multi-sectoral stakeholder command and coordination at the national and subnational level. It also strengthened the periodic monitoring of response plan indicator, including surveillance and laboratory coordination, as well as improved contact tracing, testing, and triage at health facilities to avoid exposure of patients and the health workforce to COVID-19. Enforcing the implementation and monitoring of large-scale social restriction and empowering the community as agent for change through COVID-19 key messaging and engagement were also considered as one of the area for improvement. Furthermore, the IER suggested improving telemedicine to prevent COVID-19 exposure and maintain essential health services such as immunization, tuberculosis, HIV, and non-communicable diseases program as part of ensuring the continuity of essential health services. Indonesia, which also include the IER result as a reference for the HR State Party Annual Reporting in the 74 WHE. Ladies and gentlemen, Indonesia is of the view that reviewing the operation plan of COVID-19 response through the multi-sector stakeholder interaction review is one of the best practice to collectively identify best practice, gaps, and contributing factor for correction action in the COVID-19 response effort. From our point of view, the result of the IER review has provided input for Indonesia to improve multi-sectoral preparedness coordination in line with the multi-sectoral preparedness coordination framework that was published by WHO in May 2020 to strengthen coordination for a better health emergency preparedness. Thank you. Terima kasih banyak.
Thank you so much, Your Excellency. Terima kasih.
Okay, can I still address a question to Indonesian minister or?
Yes, yes, he's still with us. Please go ahead.
Okay. Okay, so as Dr. Tedros said, the IR has allowed countries to learn about what worked and what did not work in the countries in terms of their response to COVID-19. I'd like to ask the minister, so from the IAR that Indonesia has conducted, what didn't work and how
Yeah. Ardila, you were cut off. Can you hear me? Ardila, can you hear me?
Hi.
Yeah, we lost
Can you hear
you.
me?
Can you just repeat the last part of your question?
Okay, so I'd like what from the IAR that Indonesia has conducted, what kind of response and that didn't work in Indonesia and how the government has been trying to improve it. Thank you.
Yeah, thank you, Ardila. The Minister of Indonesia, did you hear the question?
Ya, itu unmute-nya dibuka. Ya. Thank you very much, Adila, for Jakarta Post. IER is intended to be a platform for continual learning. Based on the IER recommendation, we have expanded the laboratories network and referral hospital, as well as conducting massive recruitment of contact tracer and training for contact tracing. Ministry of Health and all of the government of Indonesia has conducted effort in the 9 pillars of the COVID-19 strategic response. The IER is served as a tool to review or respond systematically, identify strengths and gaps so that we can future improve our response. One of the challenges during IER is because of large-scale social restriction. We have to conduct the IER via video conference. So there is challenge in engaging the participant of the review. However, we have managed to combine the IER with the use of participant perception survey filled by all participants that presented at the review. In this way, we were able to capture a more in-depth and comprehensive input from the participant. Thank you.
Thank you, Honorable Minister from Indonesia.